Good afternoon, Secretary of State. I just want to follow on from where Paul's questioning was relating to cancer services and waiting times. I'm just going to call out a few figures that were given to us. The faster diagnosis standard was 70.9%. It's down from 74.2% in December 23, and the target should have been 75%. Another example that was given was the 62-day referral to treatment standard was 62.3%, was down from 65%, but the target should have been 85%. Now, following on from all of that, do you still believe that we will be able to focus on a cancer strategy plan when it is swallowed up in that major condition strategy?
Thank you for your question. I'm going to try, if I may, to add a little bit of context to what we're seeing with cancer diagnoses across the NHS at the moment. So what we do know is that demand has risen significantly since the pandemic. Just to put that in context, what it means is that the NHS saw more than 3 million cancer patients from February 2023 to January 24. That's an increase of 26%, or 612,000 people in the same period pre-pandemic. And so that increase, of course, has had an impact on services. But we are nonetheless, and please don't take me as being in any way complacent, just to add some reassurance, because I know that there'll be people listening to this who may already be living with a diagnosis or maybe awaiting a diagnosis, and it will be an incredibly worrying time for them and their loved ones. We know now that nearly 6 in 10 people are diagnosed at stages 1 and 2. That's really good news, because we know that the recovery outcomes are better, both in terms of survival rates, but also the quality of life afterwards are better the earlier we can catch it. So that is a step forward. Of course, we want to improve that even further. And we also know that nearly 9 out of 10 patients are treated within 31 days of a decision to treat. Again, very, very worrying time once they've had that decision to treat. Nearly 9 out of 10 patients are getting that treatment within a month or just over a month. And so what that has meant is that 1-year and 5-year survival rates have increased for most cancers. So, for example, with early breast cancer diagnoses, women are, I think, 66% less likely to die from the disease within the first 5 years than they were 2 decades ago. But of course there is more to do, and you've rightly identified those targets. I want those targets to remain, because actually I want ambition in the service. I want people to be striving to meet those and exceed those targets. And we are going to be able to achieve this through a number of ways. So, for example, the rollout of community diagnostic centres. Some 156 CDCs have been set up across England, and that helps with testing and scans and diagnoses, not just in relation to cancer, but obviously that's a major part of it. We know, for example, the most recent figures I've had are some 7 million tests and scans and so on in the last year. That's really significant. We know also that we need to ensure that we have the workforce in place to support and treat patients. So we have seen more doctors working in clinical oncology. We're seeing more radiology doctors, and that will lead to better outcomes for patients. But all of this has happened, to return to your question about the strategy, all of this focus, all of this has happened even before I've published the major condition strategy. I absolutely understand why cancer is such a focus for all of us, both as constituency MPs, but also, frankly, as human beings, mums, dads, brothers and sisters.
I absolutely get what you're saying, but what we need to understand is you have literally made the argument for why I believe the cancer strategy should be set aside because of the large increase in numbers, and things are being buried within this long-term condition strategy. I always get it wrong, but I need to not understand, because I think you've articulated that very well, but would you ever consider making an exception of some of these conditions because of the large increase in numbers?
Well, look, we haven't published it yet.
Oh.
Invite me back when we've published it and see what you think, because, as I say, it's a finely balanced judgment. We've wanted that our motivation is not because there's some, philosophical disagreement with having a separate cancer plan. It's because we genuinely are trying to have this strategic approach, this people-centred approach. But, I know the committee will invite me back when the strategy is published, and you've quite rightly set me the challenge of ensuring that it has the focus within the strategy that you and others would like to see. And I hear that loud and clear and feel it myself.
My last question.